It started as a controversial idea in 1962, building a hospital to serve the needs of the most vulnerable citizens, a place where no one was turned away. Over the past 40-plus years, more than 2 million patients have graced the halls of this small community hospital, and the great public debate spawned a respected medical center that has evolved into a leading institution with a single purpose: to improve health.
I've been involved with the hospital since the doors opened in 1967. We helped admit patients back then, so we were busy people.
If you look at the efforts of the county commissioners many years ago, the foresight to have an institution like this, a county hospital, and you look at the industrial growth and the economic growth that was planned for our market, none of those things would have happened if we wouldn't have had a healthcare center.
And it goes back to I think the desire of the county commissioners and the hospital boards to make the hospital a self-supporting hospital.
Catawba Valley Medical Center is organized as an entity of Catawba County, and as such, it is owned by the citizens of Catawba County. We do not receive any tax dollars or county funds to operate the hospital. We've been very fortunate that we've been able to operate independently.
A lot of people think, as being a county-owned hospital, that it uses tax dollars, and that's totally false. This hospital has not used a dollar of county money since it was built.
Visionary leadership has given the staff the freedom to stay focused on the mission.
Margin is important because without a margin, you don't have a mission. But I also believe that if you worry about the mission first, the margin takes care of itself. And that's what our board has taken the approach to allow us that luxury, really, of focusing on what we do and how we do it rather than what we're going to get as a result of what we've done.
It's about patient care. If you keep that foremost, you're going to do okay.
The community's support for the project created a great corporate citizen, one that puts the needs of people first.
Catawba Valley Medical Center sees all patients in need regardless of ability to pay.
I had a very moving experience a number of years ago. A nice-looking lady and about a 12-year-old child came into the emergency room, and she had tears in her eyes. She looked at me and she said, "I've lost my job and I don't have any insurance anymore, and my little girl is so sick. Would you take care of her?" And, you know, it was, yes, I mean, that's why we're here. We will take care of you. And I had to go around and give her a hug because she, you know, and then the tears started flowing. But we are here for the community.
When somebody's hurting, sick, emergency, that's the last thing you want to think about. Do I have insurance? Do I have money in my pocket? You know, you want the services to take care of that. And this hospital does.
It's not just about health care. It's not about people coming to a center to have a treatment, whatever that might be. It really ought to be a focus on wellness.
As the region grew, the needs in the community grew too. The focus of the hospital and its healthcare would be life and lifestyle. This progressive, forward-thinking approach created programs that invested in the overall health of the community. Programs like mobile mammography.
We started mobile mammography only in the industries we went to. So we do about 360 women a month.
You know, they're working and they can't get off to go to a mammography center to get a mammogram. So when it's parked outside the door of their workplace, then it's very easy for them just to walk out the door. And the companies have been very gracious to let them do it on company time. They don't have to clock out. And we schedule one every 15 minutes, and we really make it a point to have them on the truck and off the truck in that 15-minute time span.
In 2002, an even bigger commitment to outreach came in the form of the Health First Center at Valley Hills Mall, a resource and education center and home to many of the hospital's community services.
It truly is about the people, and anyone that walks in, Health First, there's a reason they came. And a lot of times once they're there, they find we have other things we can help them with.
Continuing the mission of caring for all people, hospital leadership launched an initiative to help at-risk children and promote wellness. With the assistance of grants, Healthy House, a center dedicated to the prevention and treatment of childhood obesity, was created.
The United States has the best sick care system in the world. I think if you go anywhere in the world and somebody were to have a serious illness, they would try and come here, somewhere in the United States, to get that care. We don't do as good in our lifestyle issues as the rest of the world, and I think that's where we have to take that charge and go forward with it. And I think there's a lot of programs that we have around here that highlight, and the first one that comes to my mind is the Healthy House. I think if we all did things like that around this country, we would see tremendous improvements in our health status and the quality of life that we as a community and a nation enjoy.
I almost think, in asking about the hospital's role in what we've done and how this came to be, I almost imagine this almost would not have happened anywhere else.
In the early 1970s, Marjorie Adams came on board as the hospital's nursing director. Adams would prove to be a true innovator, putting in place many forward-thinking ideas for patient care and nursing.
This institution has always been known for wonderful nursing care.
Adams' leadership would be the foundation for the hospital's nationally recognized nursing program.
When I came here, they had what we call team nursing. And a patient had medicines given by one nurse, was taken care of by another, had an aide to help with the bath, and had treatment nurses, those kind of things. The primary nursing idea was that you had 3 or 4 patients that were given to one nurse, and she was responsible for their total care. And I remember a couple of times going and suggesting something to Mr. Case very early on, and he'd say, well, where are they doing that? And I'd have to say, nobody's doing that. Well, you know, do we want to be first? Do we really want to try that? And I never could figure that anything was wrong with being the first one to try it.
Marjorie Adams set the tone for nursing in this organization, and she set a standard that we would have more registered nurses than any other hospital in the region. And she always had a belief and a philosophy that the higher the level of education, the higher the opportunity that patients would get the right care.
We have to be a trendsetter, and for a community hospital to be a trendsetter in nursing can be very difficult.
When Marjorie called me about coming and develop a women's health program, that was unheard of. There weren't magazines on women's health. There weren't articles on women's health. There wasn't anything. You just had to come up with it as best you could.
Around 1999, Eddie Beard, who was our chief nurse officer at the time, came to the nurse leadership group and said, you know, let's do this magnet thing. I've done some reading, and it actually defines us rather than we defining magnet. The program is exactly what we're already doing.
When you build that infrastructure, you continue to build on it, and you hire the right people. You hire nurses that have that magnet personality.
It's a very rigorous, very comprehensive process to go through. The professional practice environment, the professional growth opportunities, the fact that we practice nursing using research and evidence as our basis for the best outcomes is what Magnet is about, and it is what we are.
The idea is for the patient to receive better care always along the way. That's what it's all about, really.
There are very few hospitals in the United States or internationally now who have been able to achieve a designation for 3 times.
Catawba Valley Medical Center takes pride in being the community's healthcare leader, not only in patient care and outreach, but also in approach, technology, and atmosphere. In 2010, the hospital began a renovation and expansion project to respond to the needs of the community.
Healthcare is changing very rapidly, and we are doing everything we can to keep not only our facilities but our programs up to date.
Most places say, oh, we'll buy that in 10 years. Well, then you're 10 years behind. How many people did you not diagnose because you didn't have the best piece of equipment?
I talked to colleagues in other facilities. Not only do they not necessarily have the best equipment because the hospital doesn't want to pay for the best, but just the whole infrastructure that we have here in Hickory is pretty amazing.
The folks in the administration, they understand that for us to be successful, we have to lead, and we can't move in response to other folks. We have to be at the forefront, and we've done that.
It is a major expansion, and it's one that, of all the things that I've been able to be a part of during the 22 years on the board, this is the one I probably have appreciated the most, because it will bring, without question, the highest level of care that you can find anywhere in the Unifor area.
We're in very tight space, and we're not able to provide the environment for patients and families that we think that they deserve at two critical, important times of their lives.
Early renovations included enlarging and updating surgical suites to accommodate advancements in technology.
To be able to create essentially triple the size that we were before for each operating room was key into taking us into the next phase for growth for the future.
Leading the way in radiation oncology, the medical center became the first cancer center in the Carolinas to install the TrueBeam linear accelerator. The new pavilion, the largest part of the project, is a $34 million expansion that unites all cancer treatment departments in one area.
As a physician, you want to practice the best medicine you can, and to have a facility that enables us to do that it really is an honor. And to have the equipment that we have is state of the art. There isn't anything better out there. And here in Catawba Valley, we have what I need to practice the best medicine I can.
I am a cancer survivor, and I've had radiation therapy. So to be absolutely as true as the TrueBeam will make it really is a big advantage for patients.
If you are a patient in our community, you're a person or even a family member in our community experiencing cancer, you'll have one place to come to receive all of your services.
There'll be patients that also are getting radiation therapy and will be receiving chemotherapy at the same time, so we can more coordinate that time better. Do we have time enough to do the treatment before the radiation therapy, or vice versa? So that's going to work out better than us trying to, as we say, talk across the highway.
We want our building to be one of life, that this is where you come to regain your life and to be strengthened in your life and to fight the battle of cancer. And we will have the experts there to help fight the battle, along with the decor and along with the state-of-the-art equipment, but it will be about the people.
When you take something that's going to have state-of-the-art and you're going to have those aesthetics, and then you put a team that has that compassion, that competence, the love for what they're doing, I mean, that is a win-win situation.
It is daily that we hear patients say, boy, I'm going to miss coming down here. I'm going to miss seeing everybody. And that's pretty amazing testimony to think that you would miss going down to the hospital to get your radiation treatments. And I think that speaks volume of our caregivers, the therapists, the whole department.
And it's so nice to be able to reassure someone that you have state-of-the-art equipment, but more importantly, that the emotional needs of the family were being met, and you nurture someone through that process.
The Women's and Children's area in the pavilion is designed to provide mothers and families with a positive birthing experience and a comfortable environment for labor and delivery. A new surgical suite dedicated to C-sections will be conveniently located right in the labor and delivery department.
People come here to have a baby. This is the happy part of the hospital.
I've never kept a running tally of every baby I've delivered, but doing thumbnail math, it's going to be somewhere around 4,000.
And I've taught many of them. they come into my classroom, and I don't ask, who delivered you, but I had a student the other year that came in, gave me his name, and as he gave me his name, the middle name was Miller, and he said, I have that name? And I said, no, not really. And he said, your husband delivered me. So that's, it's kind of an interesting side note when he delivers the babies and I got to teach them. That was a nice treat.
The new pavilion will house an entire floor dedicated to our most vulnerable patients, our Level 3 neonatal nursery.
The new pavilion allows us to embody really what we're already doing in a facility built specifically for our needs.
Whenever I get frustrated, I walk up to the neonate unit and just watch. I watch the nurse practitioners taking care of these children that are no bigger than this, the parents standing around anxiously. And then I look at the space they're in and I realize what we're building for them and what an improvement that will be for the families.
So we're going from 2,000 square feet to 15,000 square feet. We're taking a little corner of the room where we try to put a screen up and make it comfortable for the mom to breastfeed and be alone with her baby and have some time to bond with that baby, and we're giving her a private room.
Tiny neonates have very special needs, and there's more and more research showing that the environment is critical to the growth and development.
A perfect example of what we did was create an entire floor dedicated to our smallest and most vulnerable babies and their families.
Meeting the needs of the community for today and tomorrow has been the driving force in the decision to build the pavilion.
The new facility will give us the opportunity to provide much, much better environment for patients and their families.
And it has grown to accommodate the new needs of the citizens of Catawba County.
In those early days, hospital leadership also envisioned another need: funding for the programs and services beyond the scope of capital budgets. Thus, the Catawba Medical Foundation was formed. Over the years, the foundation has made possible many successful programs and projects, including our neonatal transport unit, CLIMB, a program for children with family members stricken with cancer, and the multi-purpose court at Healthy House. The foundation also funded multiple giraffe incubators for the neonatal nursery, specialized beds for creating a healing microenvironment for premature babies.
As a nurse leader, I know that the foundation is there to help us prioritize and to be able to obtain things that perhaps we cannot obtain through our normal budget process. It's the go-to group that says, this would make our patients' lives better. This would make patient care better. This would make the practice of our discipline or nursing better if we could achieve this.
The most significant initiative that the foundation has undertaken relates to raising funds in support of our pavilion building program. We knew that we were going to be able to fund part of it through bonds, but a portion of it would have to be through contributions from the community and from our hospital reserves.
When they asked for financial participation from medical practices, we have one of the strongest buy-ins because of our obstetrical ties. So we felt it was very important to financially support the new pavilion.
Besides the Catawba Women's Center as a whole supporting Catawba Valley Medical Center, we support it personally.
I want to see something more tangible, something that I know that's needed, something that I know that will be used. So I had no hesitation in giving to the foundation.
The foundation has always been an ancillary arm to support the hospital, and in this current campaign it's been very, very successful in raising funds to help fund the pavilion so that all the costs of the things for the pavilion aren't out of bond funds. They're not out of the operating budget of the hospital, but there's a sizable donation from the community through the foundation for the addition to the hospital. That once again just speaks to the commitment of the community to this institution.
From those controversial days in the early 60s, the hospital has flourished and grown with a keen eye on the ever-changing needs of the Catawba Valley. Continuing to innovate, evolve, and keep in step with the changes in the healthcare system will remain a challenge. At Catawba Valley Medical Center, that challenge is met with devotion to our mission, providing care for the entire community.
Well, it's been a pleasure for me to be associated with the hospital because I saw a lot of people doing a lot of good things and doing them in a cooperative way.
So if you think about the need and why an institution like this is important in the market, it's really easy to see because it's here to serve everyone.
It's not a stagnant place. It continues to grow.
We're poised not only to deliver excellent care now, but excellent care 5-10 years from now.
We've created what we think is going to be just amazing. It sort of is the national standard of care, and we've brought it to North Carolina. We've brought it to Hickory.
We know that we're here to take care of the community and that they have high expectations of us, and we do our very best to meet that.
If you can, for one moment of time, relieve someone's pain, provide some sort of comfort, even a peaceful death, then you have been successful in what you do.
People are people when they come here. They have a name. They're treated like they have a name, and they're treated like they're somebody. And that's the key to Catawba.
We're one big family, and I think we all love each other. And so that's what makes it so wonderful here.